To discuss this as well as the other issues raised during today's health briefing, we now have Greg Gregorio joining us live from Antipolo. Happy Monday, Greg. Let's start with whether the entire country is also recording a downtrend, a similar downtrend in COVID-19 cases.
Charles, happy Monday. While the Department of Health has reported that there is also a decrease in the two-week growth rate for the COVID-19 cases in the whole country, there was no mention, however, of a slowed down trend in the cases for the entire Philippines. But what's clear is that we are still having a high-risk classification for the COVID-19 transmission in the whole country. In fact, our hospital utilization is also at a high risk with more than 70%. Charles?
Greg, tell us about these regions that are still classified under high-risk category due to the number of COVID-19 cases.
Charles, according to Health Undersecretary Vergere, there are 12 regions which are currently under high-risk classification, and these are the National Capital Region, CAR, Region 2, Region 4A, Calabarzon, Caraga, Region 3, 11, 1, 12, 6, 9, and 5. And aside from the high-risk classification for their case transmission, these regions are also having a moderate to high-risk utilization of their hospital beds and ICU beds. Charles?
Right. Greg, given this slow downtrend, as the DOH would put it, when do they expect us to reach the peak of COVID-19 infections?
Just according to Undersecretary Vergere, based on the projections of FASTER in the Department of Health, we may be seeing a delayed peak, or we are expecting a delayed peak for our daily new cases. And according to their projections, the daily number of cases might peak at around late September or early October. This delayed peak might be due to the enforcement of the minimum public health standards and other interventions such as the quarantine restrictions as well as our vaccination rollout. Charles?
Right, Greg, I understand that the Delta variant cases driving surges here as well as abroad. How many Delta variant cases do we now have, and can we say that this is the dominant COVID variant in the Philippines?
Charles, based on the latest biosurveillance report of the Department of Health, we are now having more than 3,000 Delta variant cases in the Philippines, with the addition of around 319 Delta cases based on the latest batch of the whole genome sequencing back on September 18. And based on these numbers, we are now having Delta variant as the most common variant of concern among 12,000 sequenced samples in the country. This is to be followed by the Beta variant, which used to be the most common variant of concern in the Philippines. Charles?
Right, Greg, more and more vaccines are coming into the country, but I understand that there was a specific incident wherein 10,000 COVID-19 vaccines were wasted. Could you tell us more about this?
Charles, this 10,000 doses of wasted vaccines here in the Philippines was initially reported by Undersecretary Mirna Cabotaje, who is the chair of the National Vaccination Operations Center over the weekend. But according to Undersecretary Vergere, this number is the total number of wasted dosage in the Philippines, and these had a varying circumstances, such as the lack of power supply because of the recent typhoons, and some had troubles during the transportation. And Vergere clarified that this number is still well within the 5% ideal wastage by the World Health Organization, as the WHO have already pointed out that there is no perfect vaccine rollout across the globe, and this 5% is an acceptable range. Charles?
Yeah, talking about vaccination, Greg, do we have any updates on authorities allowing vaccination of children?
Charles, Vergere clarified that while there are already approved emergency use authorization for the COVID-19 vaccines of Pfizer and Moderna to be used for ages 12 and above, the all-experts group of the country for the use of vaccines have not issued their final recommendation for the pediatric vaccination in the Philippines. According to Vergere, foremost of the consideration is the safety of these vaccines to the pediatric population. And as of this date, the recommendation is still vaccinate the adult population in the Philippines because these are the ones that are still the most vulnerable and still the most at risk when it comes to hospitalization and death.